I had never heard of this procedure. I have friends who have had back issues. We weren't sure how long this procedure had been available. In reading the material, I found out more details about it, and I'm just quite honestly surprised that more people don't know about it, since it's such an effective treatment.
The typical vertebral compression fracture patient is elderly. Most commonly, the cause of compression fractures is osteoporosis, and osteoporosis, of course, is more common in elderly patients. The majority are women, but by no means exclusively women. It's osteoporosis and compression fractures are quite common in elderly men as well. The pain can be quite severe and frequently interferes with activities of daily living, and often these patients are treated with narcotics.
I would rather tell you I did it on a black diamond at Wildcat skiing, but it was nothing that dramatic. It was a very, very simple move. I tossed the bath mat up on the door of the shower stall to dry and felt this terrible snapping, excruciating pain, which I was hoping was just kind of a muscle pull, but it did not go away, and the pain increased, and it really exacerbated over the days. I was having difficulty moving about. It was really excruciating, and it seemed to encompass my entire upper body, and I found I couldn't roll over in bed. I became almost paralyzed with moving. I met Dr. Vandermeer in emergency, and from that point on, my comfort level was excellent. He explained what the problem was, what could be done for it, and how everything would proceed. And so when I left the emergency room to go home, I really felt in control again. I was feeling out of control of what was happening to me, but I felt like I had a plan, and I knew exactly what was going to happen. He provided me with some reading material in addition to explaining what was going to happen. And then I was scheduled a week later for the procedure.
Kyphoplasty is a procedure that was designed for spine compression fractures. The problem with spine compression fractures is that the fractured vertebra has lost height, so it's no longer as tall as it was, and neither is the patient as tall as he or she was. What you in general need to do with fractures is you need to restore the anatomy, and you need to then provide stability so that the fracture can heal. And it's the same with spine fractures. So what we do with kyphoplasty is, in order to restore the anatomy, we insert 2 balloons directly into the broken vertebra. We then inflate the balloons with liquid, and that restores the height of the partially collapsed vertebra. Once the height is at the desired level, we take the balloons out, and we then fill the cavity that was created by the balloons with acrylic cement. And the cement hardens in about 20 minutes and is then rock solid, as hard as bone. That accomplishes pain control and restoration of the normal anatomy, and the patient can be discharged in a matter of hours.
I came to the hospital on the day of the outpatient procedure, and I must say that from the intake in day surgery until I left later in the day, I can't say enough positive things of how much I knew. I knew every step of the way. I felt confident in the people that were working with me, and as I said, I knew everything that was going to happen and how I might respond to this. And so at day surgery, they did what you would normally expect: blood tests, inserting the port. I was then visited by the attending nurse from Dr. Vandermeer's service. The anesthesiologist came in. They both explained everything that was going to happen and what I should expect. Dr. Vandermeer came in, also reiterated everything that was going to happen. And then the next thing I knew, basically I was waking up and it was all over. And I felt good. It's been 2 months now since the procedure, and I feel like I have a confidence level back, which I didn't have 2 months ago, in terms of getting about. I noticed that my walking pace has increased back to where I normally would be buzzing along. I'm able to get outside and do some of the things that I love being outside, and I'm really looking forward to traveling more. I would have no hesitation in having this done again. Dr. Vandermeer has made it very clear that given the state of my osteoporosis and all, that it's highly probable that this could happen again. And I know exactly what I'm to do should I have this pain occur, and I would have, as I said, absolutely no hesitation.